According to the CDC, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. The factors that can impact our mental health include our genes, our brain chemistry, and family history, as well as life experiences such as trauma and stress.
One of my level ones was in an inpatient psych setting. And then I just like had a lot of interest in how I was very, um, it just clicked with me. Like that was a way I really liked connecting to patients, helping them like overcome barriers that were more psychosocial.
OT school, you sample all the things, and I just like loved mental health. Every opportunity I could, I was looking for more chances to find places I could shadow and learn from. So by the time I got done with OT school, I was like, yeah, like I'm gonna try and find a
There's
job.
so much stigma still that revolves around this, and even though we've made significant strides, still I hear every day from both even providers and of course like in general public and social media of how people with mental illness, they shouldn't be in the community, or they use a lot of derogatory terms. And I find myself as a vessel to change that a little bit and to hopefully destigmatize that.
I think resiliency is one of the words that came up for me. I think that I really feel like it's an honor to be able to support people in a time in their life that's one of the
I
hardest.
think what inspires me when working with this population is just people's grit. I think that the people I meet have the most perseverance and grit than most people I've ever met.
I think the primary challenge that I encounter in practice, specifically on the inpatient side, is the social determinants of health overall.
The social determinants of health include economic stability, education access and quality, social and community context, healthcare access and quality, and neighborhood and built environments. These include a person's ability to acquire resources for nutritious food, the ability to access transportation, and access to equitable and affordable healthcare.
So many of our patients kind of, unfortunately, are negatively impacted by the social determinants of health. For example, homelessness is such a huge contributor to that. Lack of employment, lack of social relationships, and a lot of it stems from systemic issues and also as a result of mental health conditions too.
And a lot of people will come back because they weren't taking their medications, or they couldn't get their prescriptions filled, or they took them for a few months and then it was too expensive, or like the access to resources for people who have primary behavioral health or psych diagnoses is horrible.
I'd say my biggest challenge is dealing with things like no housing for a lot of our patients, and just lack of resources, and that's not a priority for our state or our country, is really disheartening. Yeah, advocacy is a great one. I think really, speaking up and helping to break the stigma and just being a support.
We do look at the entire person, and I love just kind of going in and the fact that I can, work on so many different types of activities and skills, whether it's, social skills training, whether it's like ADL routine based or group therapy, working on like coping skills.
I think the biggest impact we have is that our goal is to just re-engage in what's meaningful to them.
Occupational deprivation is the restriction from participation in meaningful activities that may be due to circumstances outside of an individual's control. Some examples of occupational deprivation in mental health may include a stigma and anxiety, lack of resources, availability, or financial support, and the activities might be harmful to the individual's health.
the act of being on a locked psychiatric unit, you don't have access to nature often. You don't have access to a lot of the interests, hobbies, or work, or just any of those valued occupations that make up your day. We have to get really creative, which is really fun, but certainly can be challenging depending on what your clients really value.
There are so many environmental restrictions in this setting, just because of the nature of kind of the symptoms folks experience, like suicidal ideation or homicidal ideation. And there's very limited resources that you can imagine, right? So things like a standard pen, that's usually not readily available for
I
folks.
actually think a lot of times it's the occupational deprivation that's leading to their hospitalizations. I use the framing usually of like behavioral activation.
Behavioral activation is a technique designed for individuals with depression or mood disorders to gradually decrease their avoidance and isolation and increase their engagement in activities that have been shown to improve moods.
My experience shows is if you get someone to do something, they'll keep doing something else.
Making sure that you ask the right questions to gather what they're interested in and to just learn what's valuable to them.
Usually when I see folks, they are probably not in the best stage of their life, and they are here because of a major stressor or event. And so that's one thing that I think is like super valuable, especially in mental health, is developing that relationship.
Use acceptance and commitment therapy. I do.
The acceptance and commitment therapy model is a model that will encourage individuals to embrace their feelings rather than fighting them. This model is beneficial for the mental health community as they can acknowledge where their mental state is at.
Acceptance and commitment therapy, there are like 6 core processes, and they are really aligned with OT. So present moment attention, that's like mindfulness stuff. So literally just, especially for people who I work with, like who are experiencing psychosis, like just something to literally keep them in the present moment. Values, that's a core concept of ACT, and values is very easy to intervene and help people kind of focus on. So understanding the perspective they take. Committed action is like one of the core concepts of acceptance and commitment therapy. That a committed action is doing. So it's very in line with OT.
Yeah, so I really, really do appreciate and love the model of human occupation the best, especially with working in mental health. I think tapping into someone's volition, motivation has been so invaluable to me in my experience. Really just applying that and then looking at the broader context, such as folks' roles and their overall environment.
Creating a safe space to go wherever my patients like to go. That's probably my favorite. But I do really like to support my kids through puberty. I always think, it's in the setting that I work in, it's so unique that sometimes the things you'd learn from parents, my kids haven't learned in their teen years. So I think it's a really great honor to be able to support, somebody who's menstruating for the first time, or things like that it's like, wow, like this is a really profound moment. And like, the universe has sent this moment to me, so I'm going to do the best that I can to serve this patient. So there's moments like that are like, wow, like this is really awesome.